Welcome to our panelists. It's a great discussion, something that we're very, very passionate about, and I'll just share 2 minutes of an introduction with our audience, and then we'll just have this in a very sort of free discussion. We have great talent and experience across our panelists today, and in fact, not just experience, but if you look at their presence, they represent beautifully complementary parts of the ecosystem, actually. So the panel has been designed, I didn't design it, but the panel has been designed very successfully that in a way that combines policy experts, biostatistical epidemiological expertise, clinical expertise, particularly in the area of genetically inherited disease, which is the focus really of our discussion. And last but not least, the technological, operational, laboratory, how do we make it happen from a genomic perspective, component that's represented by our SVP in operations, Albarah. So I'm very grateful for your presence here. I'm quite humbled, in fact. So we're talking about population genomics, which means a lot of genomics, right? Big numbers of genomics, which the UAE is a global leader in. We've done some 800,000 genomes, as you know, here in Abu Dhabi. M42 has been blessed and honored with this mandate from the government to deliver the Emirati Genome Program. So that's the population genomics part of the title, if you wish. And the other key word in this title is, of course, prevention, right? And that is such a difficult word because in the context of a population genome program, it can take many, many different colors and shapes, right? So we're here to see really how this genomic agenda at population level scale can be linked to and impact meaningfully prevention in a very actionable way. Yeah. So let's start from Dr. Kawther, please, from a public health perspective, and because of course this is very much public health, interface between genomics and public health. What do you see as the biggest opportunity for genomics, and particularly genomic-based screening programs in reducing the burden of genetically inherited disease in the United Arab Emirates?
First of all, thank you, Dr. Lawrence, for this invitation to be at M42 booth, and I'm very happy to be along with the panel discussion with my colleagues here. And I think this is really very important because it's considered, I would say, a transformative opportunity. So today, UAE is completely changing and flipping that coin when it comes into healthcare. We're really moving from what I say, global population-based care into local population-based care. And then at that stage where we started the EGB program, and that's the Emirati Genome Program, after that, we're really looking into a different, diverse healthcare system where we are so into precise medicine, and that's basically moving into personalized preventative strategies and personalized intervention strategies. This is completely important. I would say, if you just remembered in the first day, the chairman had mentioned the importance of actually being proactive. So we're completely moving from being reactive to proactive. And I think that was one of the best, lessons we've learned during emergency crisis on pandemic COVID-19. So what I really want to highlight here is that we're not only looking into decreasing the disease burden, but rather looking into reduction of your own risk factor as an individual. Allow me to give you a lot of examples that we have. So at ADPHC, along with DOH, we really this year have a lot of next generation projects that are going on. We've started that comprehensively last year, starting with the EGP, and then we have the pharmacodynamics. So what if I tell you it's not only a matter of pharmacokinetics or dynamics, but it's also pharmacogenomics in a way, when you go to your own physician, he will start giving you a medication that has the least, side effects that can lead to certain contraindications or complications. It's the best effective treatment for you as a person. So it's really becoming more personalized. More than that, when it comes into preventative services, let's say different FHES programs, packages, and there we are looking into preventative screening programs. What if I say we have liquid biopsy that looks into certain, it's a normal blood test, very convenient comparing to colonoscopy, that would allow less risk for colonoscopies, let's say. If that, was actually powered by further AIs and further genomic studies, let's say looking for BRCA genes, 1 and 2, where we had noted in our own population, we have a group of individuals who have a high risk of getting breast cancer less than age of 40. So it was really very important to look into what opportunities we have. This will definitely decrease the risk of, unnecessary mastectomies, oophorectomies, consultations, at the same time, timely management. Other things we're looking into is the premarital genetic, screening program. It have been mandated and going live and viral, not only in Abu Dhabi, but all, 7 Emirates. I'm not pretty sure if you have heard about it, but the cool thing about it is that we're looking into around 540 genes that look into around 800 plus genetic diseases. And it's not only, increasing the awareness of the community and strengthen their own decision making, because that decision is not only a marriage decision, but I would say it's a lifelong decision. So we're looking into the diseases related to respiratory, kidney diseases, eye diseases. So if we were able to, identify these at an early stage, that you have that risk for your own offspring, that will completely change the perspective for the incompatible cases of the couples, and will definitely decrease the disease burden. One final point is that if you look into the total mortality in UAE itself, around 70% would say it's actually related to non-communicable diseases, right? So you can name it from stroke, hypertension, heart diseases, obesity, diabetes, and so on. So today we're really working on multi-omics, where it actually looks into certain proteomics in your blood and then just let us know, or it tells us basically what is your risk as an individual to have glucose intolerance. Again, I would say between brackets, diabetes, your risk of kidney diseases, liver diseases, stroke, heart failure, and so on, within only 4 years period, which means that you have your own, chance and choice to flip that, health journey where you might actually be at risk of getting a disease and having disabilities and so on. So that's what I really want to highlight on. It's not only, decreasing the risk of the burden diseases, but the risk of the factors. And today we're also happy to let you know that we're started to work on genetic diseases and newborns. So we will be starting on a pilot study, and then we'll see how this far will go on. And the beauty thing about it, I would say, is what if I tell you that we might be able to identify certain diseases in a fetus and get that intervention and a timely management while that fetus is still in the womb of his or her mother. So I think, we're decreasing a lot of disabilities, diseases, complications, and so on. And the future is bright, so just stay tuned on that.
Dr. Kawther, your answer was very broad and very deep at the same time, and I think it merits just a round of applause just to thank you for covering this subject so beautifully. It's not easy to summarize it, but you did a fantastic job. Thank you. I'll just go to Dr. Biju now, who's a pediatric neurologist, and I'll comment a bit. There are 2,600 quick Google search will verify whether I'm talking nonsense or not. About 2,600 genetically inherited diseases identified more broadly in the GCC, right? So we're talking quite a number of diseases. It's fantastic to have a pediatric neurologist on this panel because, unfortunately, a lot of this discussion in the context of rare disease and congenital disorders has a neonatal or pediatric manifestation. So what does this mean for you, sir? And particularly, how does this genomic screening component resonate with you?
Absolutely. Thank you very much for the invitation. So we've already heard, pediatric neurology is a very young, relatively young specialty. And what has happened, the paradigm shift that has happened in the last 10 years or so is exactly what we already heard. The 3 Ps, the precision medicine, the personalization of medicine, and the prevention aspect of it. So moving from a reactive to a preventive aspect. Now, neurology obviously includes a huge amount of burden in terms of the neurodisability. And since the introduction of genomics, what has changed is the way we approach these conditions. even rare disorders, although individually they are rare, taken together, they constitute a significant burden. And as you rightly said, that a huge proportion of it is the neurological comorbidity. So even if we take the other common conditions, like the neurodevelopmental conditions like autism or attention deficit hyperactivity disorder or epilepsy, genomics has completely changed the way we look at it now. So when we used to treat epilepsy with bog standard anti-epileptic medications, since the advent of genomics, we now look at, what gene mutation is causing the epilepsy. And that's up until 10 years ago, 60% of the diagnosis used to be idiopathic generalized epilepsies. And that has changed now. Now we know that what mutation it is. And then we go one step further in terms of the pharmacogenomics as to, if we decide to give this particular medication, then what is the risk of adverse effects in this child? And what is the prognosis in this particular child? All this we can give more informed diagnosis to these parents. And then taking one step further, that brings in the family counseling aspect of it, the prevention of similar conditions in the future pregnancies. And then taking one step further, we then go into the population aspect of it in terms of the screening. As we just heard, the newborn screening is now nearly 200 conditions can be diagnosed in advance. So massive shift. Cerebral palsy, for example, it's a still a sad fact that such a common condition like cerebral palsy, around 30% of these children are still misdiagnosed, where there's an underlying genetic factor for it. Same thing with autism. Autism used to be, it's not a disease, it's a neurodevelopmental disorder. But previously, once the diagnosis is made, it was all therapy, speech and language, occupational, etc. But now the first thing we think about is genetics, as to whether there is an underlying genetic condition. And we have found in the last few years that there's increasingly more and more genes are implicated. So a condition which was traditionally not thought to be a monogenetic condition is now proving that there's a significant proportion of these children do have a genetic basis. So it's completely transformed the way we've looked at it. And I think among all the specialties, probably pediatric neurology is the one specialty which has been completely transformed by this.
Thank you so much, and thank you for everything that you do to the children and families that needs so much support. It's fantastic discipline that you've chosen. I'm going to move to Dr. Budur, who is the hardcore scientist here, most hardcore, certainly from me, and from a biostatistical and epidemiological, but also bioinformatic point of view. So here we're talking about really, if you strip this down to the very basics, we're talking about massive data. Okay, we're talking about massive data, and we're talking about taking this massive data, which is 110, 120, Albarah, 120 petabytes. 120 petabytes of data that this emirate has generated in genomics and turning it into actionable prevention. It's not a trivial task. So I'd like Dr. Budur to comment on the main steps that, not in massive detail because we don't want these guys to leave, but in the main steps in this journey of taking this data from this raw status as it comes out of machines into something that's really population health and clinically actionable.
Yeah, I'd like to first start by saying that making sure that the data, the genetic data, is used and is translated into meaningful insights and information is a big part of why we do what we do as bioinformaticians. In order to do that, if I can mention a few different, let's say, steps or objectives, number one would be we want to build robust pipelines that can make us or enable us to translate raw genetic data at a scale for us to understand it and us to be able to interpret it. And then the second thing, it's very important to link genetic data to clinical health records. And that's because it would allow us to highlight how genetics is linked to certain health outcomes and what can be actionable. Number three, which is also very important is we need to be able to deliver these insights to healthcare providers in a format that they can understand and they can interpret. Now, if I may add some examples in terms of how to use those steps in terms of translating it into real prevention, I can see two different approaches. The first approach would be identifying individuals as early as possible and preventing progression of disease. And number two would be preventing disease from happening at the first place as much as possible. Of course, it's not possible overall. For the first approach, if you take familial hypercholesterolemia, for example, FH, it's a genetic condition that causes increased levels of cholesterol in the body and also increases significantly the risk of heart disease. And often what's important is people are left undiagnosed until a heart attack happens or a sudden heart attack happens. And this is where it's important to identify those people as early as possible. If we do that, we can enable their condition to be effectively managed by lifestyle interventions or even a diet as well, and ultimately save their lives. So, and this is exactly what we can do in the construct of having large genomic data and doing genomic screening within the Emirati Genome Program. The second approach is, it's mentioned a few times. I have to mention again, premarital screening program. What we are doing, it's a powerful example that showcases how we can prevent disease from happening at a population level and really showcases how we can transform healthcare into being preventative overall. Yeah, thank you.
Excellent answer. Thank you so much, Dr. Badur. I'll come to Albarah. Albarah has been with business M42 for quite a long time and also in the ecosystem in many roles. But you've had, Albarah, a very hands-on relationship with the Emirati Genome Program. You've seen it fly. You've seen it in problems. You've really managed it operationally and strategically. In the context of such a national screening program, let's call it or population level genomic screening program, what are the main building blocks from looking back and from all these learnings over the years? What are the main, let's say, 3-4 main components that impact success?
Thank you, Lawrence. This is a very emotive subject for me and very personal, to be honest, because what I've seen come to life over the last 4 years is unprecedented anywhere in the world. And I'll explain and I'll justify that comment. The vision of this program set by the leadership of United Arab Emirates during the midst and the heights of the pandemic was relentless, i.e., don't wait for this pandemic to finish. We need to carry on with this mission. Now, why this program is so different than most population genome programs or all PopGen programs in the world. PopGen programs typically take a cohort-specific disease, rare diseases, healthy populations, mix them all together, and then they try to build insights, do R&D, new discoveries, and apply public health policies based on extrapolating the insights generated from this. The vision here in the United Arab Emirates is that we're taking a PopGen, 1 million individuals being sequenced, all the way to our personal genomic program. So we go PopGen, personalized genomics for every single citizen. That is a completely different game changer here. Why it's a game changer? Because now you can still have the same objectives of a population genome program, i.e. public policies, identifying hotspots in the community where you can apply new screening programs. You can use it for discovery, novel findings in our population. But then every UAE citizen also has a genomic passport that is sequenced once, used for life. Every time they interact with the healthcare ecosystem or interact outside of the healthcare ecosystem, we can utilize this gold mine of data to allow for us to really work on the preventative measures. And to our colleagues here who talked about the premarital screening, this is a significant program that when we look at the potential it has to impact the next generation of rare inherited diseases in our next generation, we anticipate that at least 75% of all inherited autosomal recessive genetic disorders will be eliminated from the Emirati population. I don't know which country in the world can actually make those profound statements, but I know that here we can based on the data we use. But just to conclude, Lawrence, I think the genomic data is very important, and to integrate it within clinical practice, preventive models, integrate it within the way we put public health policies, genomic literacy is very important, but we need to take much more of a multi-omic / phenotypic approach to integrating these data sets. We need to find ways that we bring all these data sets in one environment that we can expedite the production of these insights to allow us to truly change the way we look at health and not healthcare, prevent disease and not treat symptoms. And I think this is really with the true strategy and vision of the leadership of the Department of Health and Abu Dhabi Public Health, as well as the UAE, has led us in only 4 years to bring to the position we're in today. The future programs that the colleagues talked about, newborn screening, premarital screening, genomic screening on a population grade, and all of the diagnostic odysseys that have now reduced from 8 years on average by tenfold just by implementing the Emirati Genome Program, is truly the impact that we see from this. Sorry, I could go on for days talking about this, but I just would like to conclude on that note. I think there is much more to come, and I think our colleagues at Public Health and the Department of Health and our clinicians, truly the game changer in the UAE is that our regulators are working hand in hand with the operators and are so supportive of delivering care to the UAE and to the globe that we are fortunate that, you know, whatever we need, we know that the regulators are actually ahead of us 10 steps. The liquid biopsy, just to conclude, is a way of screening, and I call it the liquid gold. I don't call it liquid biopsy. Is a way to screen for cancer that is non-invasive. It was the Abu Dhabi Public Health colleagues that were pushing people like us to find these innovative solutions to bring to the UAE to start looking at how we can reduce cancer as a disease burden here in the UAE. So we're very fortunate. The ecosystem is working all together cohesively, and we're very fortunate that we're making impactful changes every single day.
Thank you so much, Albarah. Very inspiring. We've run out of time. There were many more questions on this list, but I think we'll just close with Dr. Kawther again. Maybe I'll ask Dr. Biju just for a quick comment. But let's just close, if you wish, Doctor, on policy and public engagement mechanisms for adoption. Because always when we talk about technology, in essence, technology, system transformation, innovation, moving from reactive to proactive, all this is change. And change, of course, is linked to adoption and to engagement, which quite quickly, if you can, because we're being pushed out, your perspectives on that, please.
So thank you for giving me that opportunity for the closing. I just want to mention here the most important thing for any change or any new thing that you want to bring to your community. As simple as that, it starts with inclusivity. So I usually say within my team, inclusivity comes at two different layers. The first layer, ensuring that the internal stakeholders and the external stakeholders are really involved. And that's one of the reasons why all of us here, we're talking about and similar things, very well aligned within the same vision and goal. Now, second thing is we do put in our mind, any ethical considerations, cultural and social sensitivity as well. It's very important because at the end, you really wanted to have buy-in, not from these different partnerships and collaborations that you have with different stakeholders, but also from the community, because that's the mainstay when it comes into the successful of each or any program that you really want to have it on within the community. Now, the other thing that we really look into is the feedback mechanism. The community outreach campaigns that we do to ensure very comprehensive, extensive, I would say, and proactive engagement of the public. So all in all, it's inclusivity of your own community, the different stakeholders be really fully aligned. Ensure what is your current capacity, what are the different training sessions, upskills that you can support the healthcare providers, what are the different KPIs that you really look into to help you in addressing the gaps and overcome the challenges. So I would say it's a collective of strategies, and I remember remember in one of our meetings, Lawrence, we had a suggestion, why not to collaborate even with educational institutes and start to have introduction of genomic medicine within the curriculum to ensure that the future generations are well informed and well prepared. I think this step is really awesome and important. And within that, we really believe that capitalizing these opportunities, the UAE would be a leader in genomic medicine.
These panelists have proven without any doubt that Abu Dhabi and the UAE are stratospherically advanced in this very complex agenda. We used to be flying to the States, flying to the West to be educated on these themes. I think now we're proving that these flights should be going the other way around. So I want to thank you very, very much for your excellent insights today and for giving us your time for this brilliant panel. Thank you.